you're talking about two, just so people know. So we look after some 73,000 patients, Dave, as you know. We're a workforce of 4,000 and a budget of about 230 plus million. And I'm sure it's more than that. And just so that, as you said, we're trying to make things easier for people so that people understand. And that's why we come on this show to talk about, the fantastic organisation that we're both privileged to work for. But just tell us, where do you start with, you've got a £200 million budget, 400 staff in terms of workforce, plus all the assets and the estates that you have to look after as well. That is a big responsibility, Dave. Just talk to us a little bit about, what that really entails in terms of, I'll go on to information governance, but let's start with that budget. How do you even begin to manage that?
It certainly keeps you awake at night, Beresford, but probably just to move it on a little bit, where we are now, we've recently taken on responsibility for commissioning as well as providing. So we also arrange for services as well as provide them themselves. So if you take that into account, all the income that we're responsible for, we're actually getting on for £500 million, so 500 million. So if you like, the provider side, where we deliver services, is probably less than half of the overall. Okay?
Wow.
So we both commission services from others and commission services from ourselves.
But
you're right.
We're going to talk about commissioning after, because that's a very, very new role for us. So, we'll talk about that in detail.
Okay. I'll talk about what you asked about.
Yeah.
So our current budget for the provider side, so the people that deliver services, it's approximately 300 million now. So we provide services right across Birmingham and indeed for the West Midlands. So as well as the core local services, so that's the mental health inpatient services and the mental health community services we provide, we also provide some specialist care. So we do things like, for instance, deaf services for mental health, which is a regional service. We also provide secure services for the entirety of the West Midlands, and we work with others on that. So you've got 4 divisions, operating divisions within the organisation. They've all got their own budgets and their own staff, and really it's about enabling them to actually manage the service, deliver high quality, and also manage their budgets. In some areas, they've got significant problems in terms of being able to make sure we've got the right numbers of staff. So, for instance, if you talk about inpatient services, we're significantly challenged by being able to recruit people in the right level of numbers with the right qualification to work on the services. So we are quite dependent still on temporary staff. It's a real staffing crisis in the NHS generally, but particularly for us, it's in the acute inpatient services where we struggle. It's also therefore really important that we retain the staff that we've got and do what we can to develop. So we would look for the local management teams in each of those service directorates, who are typically led by an associate director and a clinical director, doing the both parts, the business side, but also the clinical side, to make sure they deliver the overall piece in that area to their local population, the people they serve, to make sure that they deliver the highest quality, do the recruitment to get all that working through. So the building blocks for the organisation around those local services. And it's for the associate director and the clinical director leading that team to make sure they deliver. My role is about making sure that we've got clear rules of the game in there, so it's clearly understood who can decide what, who can spend money at what level, and what the rules are. I work with people rather than spend the money myself. So I've joked at the previous annual general meeting. People talk about me as the money man. I'm not. I tell people where it's gone to. I spend very little of it myself. So this is really about making sure you've got sound governance on the ground with those services, knowing what they're doing, delivering to certain standards and setting those standards within a set of rules of the game. So it's like many people like me who work at the centre or in headquarters or in non-clinical functions, we're, if you like, setting the framework and the rules and providing really strong support to those services. So, for instance, if someone wants to develop a new service or develop a new building, a base for something, they develop what's called a business case to justify investment in those areas. And people that work for me would support them in developing that business case, which says, why are we doing this? What's the benefit? How much is it going to cost? How do we pay for it? And what's the timeline around it? Brilliant. Again, does that give you?
Yeah, that's great. There's some stuff there that we can certainly go into. If you've just joined us, thank you for joining us on Unity FM. My name is Beresford Dawkins. We're talking to our Executive Director of Finance, Dave Tomlinson, and as you've heard, it's just people would see him as an accountant, the money man, as he calls himself, or as other people call him. But as we can see, that his role is far more complex. He's telling us that we've increased our budgets or our commissioning ability, I'll call it that, to up to £500 million. And again, I can't even imagine where to start with that. But from a delivery point of view, we're responsible as a trust for up to £300 million, of which there are various different services in that. So in case you missed them, inpatient, specialist, deaf service, and also secure. And that doesn't include, and we haven't even mentioned acute services yet, and all the other things that we do within that in terms of staffing. And Dave, I think I want to talk about the staffing, because I know that there's some challenges, like you rightly say, around retention and getting the right staff and holding on to them as well. And it's a difficult time for the NHS right across the board, as we know. But I also say, actually, it's a significant opportunity for us to think about how we go about recruiting the right people for the trust that we work in, which is one of the largest trusts, certainly in the Midlands anyway. And the temporary staffing and the retention issues, clearly that comes to you often, I would have thought. And how do we get over some of the challenges that we see? And how can we start to think about recruiting some of the very people that might be listening to this program? Because I always say people are not going to come to NHS jobs often to look for work, but how do we position ourselves as an organisation to access the talent on the margins, as I always describe it?
So I think there's a whole range of things that we need to do here, Beresford, and I'm not sure we do them all as well as we should, but we know that we need to do things significantly different. We know that just remaining the same as we are now won't cut it. We know we've got a challenge. We know that people can go anywhere, not just in the NHS, but elsewhere. We know that there's a certain fixed salary, which is a good salary, but it's not as good as it used to be with the pension, etc. So we know we'd struggle to compete financially. It's about much more than that, though. It's about demonstrating some of the great things that we do and some of the great opportunities people get. When I do inductions, I tell people the only constraint when someone comes into the organisation is what they bring themselves. They can literally go anywhere, do anything, rise as far as they want to and develop. We've got to make sure we've got systematic opportunities for everyone to benefit. We've got to make sure we give people all those other added benefits of working for an organisation like this. We've also got to make sure we're touching local people in local areas in a way that is, you're right, it's not NHS jobs. How do we make sure that people on the street actually understand how to make contact? And we can all do that from a day-to-day basis when, we meet local people. But it's also about trying to find a systematic way to get into those areas, to describe what it's really like and make it really easy to join us. Often there's a bureaucracy and it gets in the way. I really push hard in that area. We've got to be really clear about how we make it easy to get people in. We've also got to be able to demonstrate, why would you come to Birmingham from outside? This is actually a fantastic place. We provide some fantastic services. Often we'll talk it down and we'll say how awful it is and what we haven't got. We've got some wonderful things. And I always talk about, how do we spend the 600 million rather than how we save 10 million? And I think we've got to do the same thing with staff. Tell them what's good about this place. Get people and get services to describe real opportunities. You talk to people on the ground. they really love this organisation and what they do, often despite the organisation. This is really about people. In average terms, we get people staying on average 8-9 years, but we talk about 12% turnover. I think it's about, you've got to take the right approach, and you've got to talk people in an adult way about what this is like and what they can do, how they can get involved. I also think we need to widen in terms of not just the current employment models, but what can we do in terms of different hours, different flexibilities. As part of the commission we're doing, and I know we'll come back to it later, but a heavy part of that is involving the voluntary sector. And in many cases, they can attract people and deliver services in a way that we can't. And we need to work with them to try and get the right numbers of people in, of the right quality, into the overall system.
Dave, I'm really with you with this, Dave. And yeah, you know, I've lived in Birmingham all my life. All my family lives here. Both my parents, who are no longer with us, but also my children and my grandchildren. We all live in Birmingham. Love the city. Really passionate about it.